So here's something kind of unbelievable. Right now, in the United States, there are millions of people walking around with a disease that their own doctors are missing. Not because the doctors are bad at their jobs. Because this disease is really, really good at hiding. And look, if you just had blood work done and it came back normal, you're probably thinking, okay, that's not me then. I get it. But that's actually the exact trap most people fall into with this one, because normal labs don't rule it out. In the US, the standard first-round blood panel doctors run can come back completely clean, even when this disease is very much there. There's one specific test, and I mean one test, with a specific name, that most doctors won't order unless you ask for it directly. I'm going to tell you exactly what it's called, so stick with me. I'm pulling all of this from actual peer-reviewed rheumatology research, not internet guesswork, so what you're getting here is what's really in the medical literature. By the end of this video, you're going to know the 8 signs doctors in the US commonly overlook, the exact test to ask for by name, and how to walk into your next appointment and actually get taken seriously instead of walking out with another "everything looks fine." Hit subscribe and leave a like. That helps this channel reach more people who need it. The goal at Health Inside is 200,000 subscribers, and every single person who joins moves us closer. And if you want the full Sjogren's symptom map guide with visuals, symptom breakdowns, and additional resources, type symptom map in the comments, and I'll send you the link to access it. Let me tell you about a woman I'll call Sarah, 47 years old, lives here in the US, sharp, active, holding down a career and a household, the kind of person who never really got sick. Then one year, she starts losing words mid-sentence. Goes to her doctor. Probably stress. A few months later her hands ache every single morning. Doctor says, maybe early arthritis, let's just keep an eye on it. Then her mouth won't stop feeling like cotton, no matter how much water she drinks, and out of nowhere she's getting cavities, even though she's brushing and flossing like always. It takes 3 different doctors and about 2 years before somebody finally runs the right antibody test. Turns out it's Sjogren syndrome. It had been there the entire time. Nobody just called it by its name. And here's the thing, this isn't some rare, unlucky case. In the US, this is basically the norm for how this disease gets found. So what's actually going on here? Sjogren's is an autoimmune disease, which basically means your own immune system gets confused and starts attacking the glands that keep you moist, your tear glands, your salivary glands, that kind of thing. That's why it usually shows up first as dryness. But, and this is the part that surprises people, it doesn't stop at dry eyes and a dry mouth. Those same gland tissues show up all over your body, so this thing can end up touching your joints, your lungs, your nerves, even your kidneys. And in a smaller number of cases, it actually raises your risk of lymphoma. Which is exactly why catching it early actually matters, not just for comfort, but for your long-term health. It also shows up way more in women than men, and it loves to travel in a pack with other autoimmune conditions like rheumatoid arthritis or lupus. Honestly, that's part of why it slips through the cracks. Doctors treat the condition they recognize and just stop looking any further. Alright, let's count these down, and seriously, keep score, because most people watching this are going to hit at least 3 or 4 of these, and by the end you're going to understand exactly why they're all connected. Before we start, here's why I'm doing this as a countdown instead of just listing them in order. The way most people experience this disease isn't one symptom at a time, it's several of these showing up over months or years, in a scattered order, each one getting treated by a different specialist as if it's its own separate problem. A rheumatologist sees the joints. A dentist sees the cavities. A cardiologist sees the palpitations. Nobody's in the room connecting all 11 of these back to one underlying cause, which is exactly why this list exists, so you can be the one connecting them, before a doctor even runs a single test. Symptom 11. Crushing fatigue. And I don't mean I could use a nap. I mean sleeping 9, 10 hours and waking up feeling like you got hit by a truck, every single day, with no obvious reason why. This isn't burnout, and it isn't depression, even though that's usually the first thing people get told when they bring it up. Underneath it, your immune system is actively driving low-grade inflammation through your entire body around the clock, completely different mechanism than being tired from a long week or bad sleep. It doesn't respond to rest the way normal tiredness does, because rest isn't what's being depleted here. Denise, 44, out in Ohio, spent 3 years being told to manage her stress better before anyone tested her for anything autoimmune. She started rationing her energy like a budget: shower or make dinner, not both. Attend her daughter's recital or grocery shop, pick one. By the time she got a real answer, she'd already quietly quit the job she used to love, because she couldn't trust her own energy from one day to the next, and she'd stopped explaining it to people because nobody seemed to believe how bad it actually was. That's the real cost here, not just feeling tired, but the slow erosion of a life you used to have. Cancelled plans. Feeling like you're constantly disappointing people. Wondering, quietly, if you're just lazy, when you know deep down that's not it. Don't let anyone call this laziness or burnout. And don't let a doctor wave it off with, well, you have a lot going on. Write down exactly how many hours you slept versus how you actually felt the next day for 2 weeks straight, because that gap, on paper, is the detail that changes how a doctor listens to you. Left unaddressed, this kind of fatigue doesn't stay in its lane. It compounds with the brain fog and joint pain coming up later in this list, because they are all being driven by the same underlying process. More sleep and more coffee won't touch it, no matter how disciplined you are about it. But once the underlying inflammation actually gets treated instead of just managed around, patients genuinely do get real energy back. This is one of the symptoms that responds best to catching it early. Here's how this is different from ordinary chronic fatigue or simple anemia, which is where it often gets lumped in. With anemia, a basic blood count usually shows the answer right away: low red cell counts, iron issues, something concrete. With this, standard blood work can look completely fine while inflammatory markers, which aren't part of a routine checkup panel, are quietly elevated. That's the gap. If your doctor has only ever run a basic CBC and told you you're not anemic, so you're fine, that's not actually a full answer. It just rules out one possible cause, not all of them. Quick gut check before you keep watching. Has this fatigue lasted more than 3 months, and does it stay roughly the same regardless of how much you sleep? If you just nodded, that's worth writing down right now, before you forget the exact wording. So if this is you, type fatigue in the comments and I'll send you a simple 2-week tracking sheet you can literally hand to your doctor. Symptom 10. Sudden cavities out of nowhere. You've brushed and flossed your entire life, never had a real dental problem, and suddenly your dentist is finding 3 or 4 new cavities in a single year, sometimes in strange spots, like right along the gum line or near the roots of your teeth, places cavities don't usually show up in someone with decent oral hygiene. Renee, 35, in Michigan, had never had a cavity before in her life and needed 4 fillings in 18 months. Her dentist actually said, out loud, "I've never seen anything like this in someone with your hygiene." And then, unfortunately, just filled the teeth and moved on without asking the obvious next question. She went through 2 more rounds of fillings before a totally separate doctor happened to ask if her mouth ever felt unusually dry, and that's when the pieces started coming together. Here's the mechanism in plain terms. Saliva isn't just there to keep your mouth comfortable, it actively neutralizes the acid that eats away at enamel. When your body's saliva production drops, even if you haven't consciously noticed feeling dry yet, that protection disappears, and decay accelerates fast, no matter how well you brush or floss. This is one of the cruelest parts of this disease, because patients often get quietly blamed for it. You must not be flossing enough. Maybe cut back on sugar. Don't accept that as the final word. Tell your dentist directly, using this exact phrasing: "I've been getting cavities in unusual places despite good hygiene. Could this be connected to a saliva or gland issue, not just diet?" That specific question is far more likely to get you an actual referral instead of just another cleaning schedule. Left alone, this becomes a cycle: fillings, more cavities, more fillings, because nobody's treating the actual cause. There's a specific pattern worth knowing here too. Ordinary cavities tend to show up between teeth or on chewing surfaces, where food gets trapped. The pattern connected to reduced saliva shows up differently, along the gum line, and especially at the roots of the teeth, areas that are usually well protected in people with normal saliva flow. If your dentist mentions root caries or cavities in an unusual location more than once in a short window, that's the specific phrase worth remembering and bringing up with a doctor, not just your dentist. Quick check. Count how many fillings you've needed in the past 18 months. If it's more than 2 and your habits haven't changed, that's not a coincidence worth ignoring. If you've had this happen, type cavity in the comments and I'll send you the exact 1-line script to bring to your next dental appointment. Symptom 9. Joint and muscle pain with no swelling. Achy hands, wrists, knees, sometimes migrating from one joint to another over the course of a week, but when you actually look at them, or when a doctor examines them, nothing's visibly swollen. No redness, no obvious inflammation to point to. Just pain that's very real and very disruptive. Monica, 41, in Arizona, gave up gardening, her favorite thing in the world, the thing she looked forward to every weekend, because opening a bag of soil left her hands throbbing for the rest of the day. Every X-ray she got came back completely clean. Completely normal. So she was told, more than once, that it was probably just wear and tear from age, or maybe she'd slept on it wrong, repeatedly, for 2 years. That clean scan is exactly why this gets dismissed so often. Doctors are trained to look for visible damage, and this kind of joint involvement frequently doesn't show up that way, at least not early on. Ask your doctor specifically whether the pain is symmetric, meaning both hands, both knees, at the same time, not just one side, and how long morning stiffness lasts once you're up and moving. Stiffness lasting over an hour is a genuinely meaningful clue, not just getting older, and it's a specific detail that shifts how a doctor thinks about your case. Left unmanaged, this tends to make ordinary things harder in ways people don't expect. Gripping a steering wheel for a long drive, opening a jar, typing through a full workday. And it tends to flare in lockstep with the fatigue you may already be dealing with, because they share the same underlying driver. Over-the-counter pain relievers can dull the ache for a few hours, which is genuinely useful for getting through a day, but they don't touch why it's happening in the first place. The actual diagnosis is what opens the door to treatment that addresses the cause instead of just the pain. This is also where a lot of people get funneled into a rheumatoid arthritis diagnosis that doesn't quite fit, or get told they don't have RA and sent away with nothing. Here's the distinguishing detail. True rheumatoid arthritis usually causes visible joint damage and deformity over years if left untreated. This kind of joint pain, even when a blood test comes back positive for rheumatoid factor, which does happen here more often than people expect, typically doesn't cause that same permanent joint destruction. That distinction matters, because it changes the treatment approach, not just the label. Quick check, time your morning stiffness tomorrow with your phone. If it runs past an hour before your joints loosen up, write that number down. It's more useful to a doctor than my joints hurt in the morning. If mornings like this sound familiar, type joints below. Symptom 8, brain fog and losing your words. Standing there mid-sentence, in a meeting or a conversation with your own kid, and the word is just gone. Not a rare occasional slip, a daily, frustrating, disorienting thing that makes you start to doubt your own mind. Karen, 48, in Oregon, got passed over for a promotion she'd been working toward for years, because her manager quietly noted that she seemed scattered and disorganized in meetings. What was actually happening was that she was fighting, moment to moment, to hold a single train of thought together, and there was no way for anyone around her to see that battle, so it just looked like carelessness from the outside. Don't let anyone call this mom brain, or stress, or normal aging, especially if it's a daily occurrence rather than an occasional one. Tell your doctor plainly, using this phrasing specifically, I lose focus and lose words daily, not occasionally, and it's affecting my work. That framing gets taken far more seriously than I feel foggy sometimes, because it signals frequency and impact instead of a vague complaint. Left unaddressed, this tends to worsen right alongside the fatigue and any dryness symptoms you have, because your brain is essentially working overtime, moment to moment, to compensate for what's going on underneath. More sleep and brain training apps won't fix inflammation-driven fog. That's treating a symptom of a symptom. But identifying the actual underlying cause opens up real treatment, not just coping mechanisms, and for a lot of people, this is one of the symptoms that improves the most once things are properly managed. It's worth knowing how this differs from ordinary anxiety-driven distraction, since that's the label it gets slapped with constantly. Anxiety-related distraction usually comes with a clear trigger you can point to, and it tends to ease up once the stressful situation passes. This kind of fog often shows up completely independent of stress levels, sometimes worse on days that are otherwise calm, and it specifically involves word retrieval and short-term recall rather than general worry or racing thoughts. Quick check. Over the last week, how many times did you lose a word or a thought mid-sentence, in a way that felt different from normal forgetfulness? If you can count more than 2 or 3, that frequency is exactly what's worth saying out loud to a doctor. If you've lost a word mid-sentence more than once this month, type foggy in the comments. Symptom 7. Burning or tingling in your hands and feet. Pins and needles that never fully let go. Sometimes it's a genuine electric shock feeling that shoots through without warning. Sometimes it's a burning sensation so specific that patients describe it as feeling like their feet are on a hot stovetop, even though nothing's touching them. Diane, 55, in Florida, spent 2 years blaming this on ill-fitting shoes, buying new pair after new pair, before anyone connected it to anything autoimmune at all. Here's the part that genuinely throws doctors off. This can show up years, sometimes a full decade, before any other classic symptom even starts. So it gets written off, again and again, as a pinched nerve, a vitamin deficiency, or just getting older. Diane was told to take a B12 supplement and given a follow-up appointment 8 months out. Don't just accept a supplement recommendation and move on if the symptom doesn't improve. Ask specifically for a small fiber neuropathy workup. This matters because standard nerve conduction tests, the ones most neurologists run first, frequently come back completely normal even when this is very real and very active, because those tests only measure larger nerve fibers. You may need to specifically request a skin punch biopsy, which checks the smaller fibers that are actually affected here. Left untreated, nerve damage like this can become permanent over time, which is exactly why catching it matters more than almost anything else on this list. This isn't just about comfort, it's about whether the damage is still reversible. The most common mix-up here is diabetic neuropathy, since the symptoms can look nearly identical. The differentiator is context. Diabetic neuropathy comes with a diabetes diagnosis and usually climbs slowly over years alongside blood sugar issues. This kind of nerve involvement can appear in someone with completely normal blood sugar, sometimes alongside other clues like dizziness when standing up too fast, which points toward the autonomic nervous system being involved too, not just sensation in the hands and feet. Quick check. Does the burning or tingling get noticeably worse at night, or when sheets or socks touch your skin? That specific detail, worse with light touch, worse after dark, is a real clue, not a random detail. If this describes your feet or hands at night, type nerve below and I'll send you the exact test name and how to phrase the request to your doctor. Symptom 6. A dry cough or shortness of breath that won't quit. Not allergies, not a leftover cold that's taking a while to clear, a persistent dry cough with no clear trigger, or getting winded walking up a single flight of stairs you used to take without thinking twice. Teresa, 50, in Colorado, was treated for seasonal allergies for 2 straight years, different antihistamines, different inhalers, before anyone finally ordered an actual scan of her lungs. By then, she'd stopped taking her dog on the walks she used to do every morning, because she couldn't make it around the block without stopping to catch her breath, and she genuinely thought that was just what being in her 50s felt like now. Don't just keep restocking allergy medication that clearly isn't working after a reasonable trial. Ask for a pulmonary function test specifically if a cough or breathlessness has gone on for more than a few weeks rather than days. That time frame is the detail that should prompt imaging instead of another prescription refill. Left unchecked, this can progress toward lung scarring that doesn't reverse once it's set in, which is exactly why catching it on a scan early, before symptoms even worsen further, matters so much here. The clue that separates this from ordinary asthma or allergies is response to treatment. Asthma-related cough and breathlessness generally respond, at least partially, to an inhaler. This kind often doesn't. Patients report using an inhaler exactly as prescribed with little to no relief, and that lack of response is itself a meaningful piece of information, not just bad luck with the wrong inhaler. Quick check. Walk up 1 flight of stairs at a normal pace right after this video and pay attention to how winded you feel compared to a year ago. If the difference is noticeable, that's worth mentioning by name, more winded than a year ago on the same stairs, at your next appointment. If a single flight of stairs wins you more than it used to, type breath in the comments. Symptom 5. Digestive trouble that doesn't add up. Food feels like it's getting stuck somewhere on the way down. Needing a sip of water with literally every bite, even of something soft. Bloating and nausea that show up with no clear pattern to what you ate. Linda, 46, in Nevada, stopped going out to dinner with friends entirely, because she was genuinely afraid of choking on bread in front of people at the table, a fear she never voiced out loud, so her friends just assumed she'd become antisocial, and she let them believe it rather than explain something she couldn't fully explain to herself. It's easy to blame this on a sensitive stomach, stress eating, or a garden variety intolerance. But describe it to your doctor specifically as difficulty swallowing dry foods, not just stomach issues, That specific detail points toward reduced saliva production and slowed motility, rather than a standalone digestive problem, and it changes which specialist you actually need to see. Left unaddressed, this can quietly lead to avoiding whole categories of food and losing weight without meaning to, which then complicates things further. Antacids and fiber supplements won't fix a swallowing or motility issue at the root, but correctly identifying the actual cause opens up real management instead of years of guesswork. This one gets folded into IBS constantly, and the way to tell them apart is what actually triggers it. IBS symptoms tend to track with specific foods, stress levels, or a menstrual cycle, and vary quite a bit day to day. This kind of digestive trouble tracks specifically with dryness. Dry, crumbly foods like crackers or plain meat are consistently harder than anything with sauce or moisture, in a pattern that stays pretty consistent rather than fluctuating with mood or stress. Quick check. Think back to your last few meals. Did you need water specifically to get through dry foods like bread, crackers, or plain meat, more than sauced or liquid-based dishes? That pattern, not just I get thirsty when I eat, is the detail worth mentioning. If eating in public makes you anxious for reasons like this, type swallow below. Symptom 4. Heart palpitations or fingers that turn white in the cold. Your heart suddenly racing while you're just sitting still, for no identifiable reason. Or your fingers turning stark white, then blue, then red the moment it gets cold outside, a reaction way more dramatic than just cold hands. Michelle, 43, in Minnesota, spent years assuming her white fingers were simply poor circulation from a lifetime in a cold climate, until a doctor, almost as an afterthought, asked whether her heart ever raced unexpectedly too. It turned out both were symptoms of the exact same underlying issue, something no one had thought to connect in 5 years of separate appointments for each complaint. Don't write either of these off separately, just being cold-blooded for the fingers, too much caffeine, or anxiety for the heart. Mention both together to your doctor specifically, in the same sentence if you can, because that exact combination is a real, recognized diagnostic clue, not two unrelated coincidences that happen to occur in the same person. Warm gloves and cutting back on caffeine genuinely help a little at the surface level, but they don't touch the actual vascular involvement underneath. Naming the real underlying cause is what gets you treatment that actually works instead of a lifetime of workarounds. It's worth saying plainly, the white fingers reaction on its own, called Raynaud's, is actually common and usually harmless in the general population, which is exactly why it gets waved off so easily. What changes the picture is context. Raynaud's showing up alongside unexplained palpitations, joint pain, or fatigue is a different situation than Raynaud's occurring completely on its own in an otherwise healthy person. That combination is what's worth naming out loud to a doctor, not the finger color by itself. Quick check. Next time it happens, notice the exact color sequence in your fingers, white, then blue, then red as they warm back up, and note whether you've also had any unexplained racing heart episodes in the same month. Writing both down together, with rough dates, is more useful than mentioning either one in isolation. If your fingers do this, type cold in the comments and I'll explain exactly why it pairs with the heart symptom. Symptom 3. Needing to pee constantly, especially at night. Waking up 3-4 times a night, every night, to use the bathroom, even though your urine tests keep coming back completely clean, no infection, nothing abnormal on paper. Barbara, 58, in Ohio, was checked for a bladder infection repeatedly, treated with a course of antibiotics more than once just in case, with nothing ever actually showing up to explain it. She started avoiding drinking water after 6 p.m. entirely, which didn't help, and eventually stopped sleeping through a single night for the better part of a year. Don't just accept small bladder or that's normal as you get older as the final answer, especially if it's this frequent and this disruptive. Ask specifically for a basic metabolic panel checking your acid-base balance, not just another urinalysis, because a standard urine test can completely miss this. What's actually going on here involves the small tubules inside your kidneys, not an infection, and that requires a different kind of test to catch. Left alone, this fragments your sleep every single night, which feeds directly back into the fatigue and brain fog you may already be dealing with. This is one of the clearest examples of how everything on this list is actually connected, not a coincidence of aging. Cutting fluids before bed doesn't fix a kidney function issue at the source, but catching this early prevents it from progressing into real, lasting kidney damage. This gets mistaken for an overactive bladder more than almost anything else on this list, and the distinguishing detail is in the blood work, not the bathroom habits. An overactive bladder is a plumbing and muscle issue. The kidneys themselves function normally. What's actually happening here can show up as a specific blood chemistry pattern, including low potassium levels and a buildup of acid in the blood, things a bladder specialist won't necessarily think to check, but a basic metabolic panel will catch immediately. Quick check. Count how many times you actually get up to urinate overnight, for 3 nights in a row, and jot down the number each morning. More than twice a night, consistently, is the specific threshold worth bringing to a doctor rather than just saying I pee a lot at night. If you're up more than twice a night, type night below. Symptom 2. Unexplained rashes or purple spots on your skin. Small purple or reddish-brown spots, usually on the shins, that don't fade the way an ordinary bruise would over a few days. Sometimes they are flat, sometimes slightly raised. Sandra, 49, in Illinois, was told for months it was just dry skin, or maybe a mild allergic reaction to a new laundry detergent she'd switched to. She started wearing long pants even in summer, embarrassed by how the spots looked, quietly convinced she'd done something wrong to her own skin. Here's a simple thing you can do at home. Press gently on one of the spots. An ordinary bruise will blanch, turn lighter, under pressure. This kind of spot typically won't. Don't just moisturize and move on if that's the case. Show it to your doctor directly, in person, and ask plainly if it could be vasculitis. This particular marker is tied to a higher likelihood of more serious involvement elsewhere in the body down the line, which is exactly why it shouldn't get brushed off with a topical cream. A cream treats the surface, not the vessel inflammation actually causing it. Catching this one early means closer monitoring going forward, and closer monitoring is what actually protects you long-term rather than reacting after the fact. The blanch test is a good first check at home, but the real confirmation is a skin biopsy, which a dermatologist can do quickly in office. It's also worth asking specifically about a blood marker called cryoglobulins, since spots like this paired with a positive result there tend to signal a case that needs closer follow-up than spots alone. Don't let a single dismissive glance at a rash end the conversation. Quick check. Take a photo of the spots the day you notice them, and another a few days later. If they haven't visibly faded the way a bruise would by day 4 or 5, that photo comparison is worth bringing in with you. If you've seen this on your skin and been told it's nothing, type spots in the comments. Symptom 1. Swollen glands near your jaw. This is the one to take the most seriously on this entire list. Puffiness near the angle of your jaw, sometimes on both sides, coming and going with no clear pattern, or, more concerning, swelling that stays and only affects one side. Carol, 61, in Pennsylvania, had that exact one-sided swelling dismissed twice, first as probably a swollen gland from a cold, then as likely just aging tissue, before a third doctor finally ordered imaging and a biopsy. The swelling had actually been there, on and off, for the better part of a year by the time anyone took it seriously enough to look closer. Don't assume ongoing, one-sided swelling is nothing, especially if it's lasted more than a few weeks. This is specifically something doctors are trained to watch closely, because the same immune cells driving everything else on this list can, in a small percentage of long-term cases, cluster and develop into lymphoma. I want to be completely straight with you here. This is not common, and it is not a reason to panic over an ordinary swollen lymph node from a passing cold. But persistent, one-sided swelling that doesn't resolve on its own is exactly the pattern that's meant to be flagged for a closer look, not because it usually means the worst-case outcome, but because catching it early, when it does matter, makes all the difference in the world. If this is happening to you right now, don't wait to see if it goes down on its own. Call your doctor and get it looked at instead of waiting for your next already scheduled appointment. Here's the detail that separates ordinary swelling from something worth a closer look. A swollen gland from a passing virus is almost always temporary, usually resolves within a couple of weeks, and tends to affect both sides fairly evenly if it's related to an illness like mumps. Swelling that's asymmetric, meaning noticeably worse or only present on one side, and that persists well past a normal illness timeline is the specific combination doctors are trained to take seriously, and it's usually confirmed or ruled out quickly with a simple ultrasound. Quick check. Press gently along the angle of your jaw on both sides and compare. Is one side noticeably fuller or firmer than the other, and has it been that way for more than a few weeks? That comparison, one side versus the other, is exactly the detail to describe out loud rather than just saying, "My glands feel swollen." And if you've noticed this, or you're not sure if what you're feeling counts, type JW in the comments and I'll walk you through exactly what to ask for. If you counted 3 or more of these just now, sit with that for a second. Not to panic. Panicking doesn't get you anywhere useful, but because that number is information. It's the difference between walking into your next appointment saying, "I don't know, I just feel off," and walking in with 11 specific, nameable things, several of which you can now explain in a doctor's own language. That shift alone, from vague to specific, is what actually gets people taken seriously after years of not being believed. That's exactly why the next part matters. Here's why this keeps slipping through, especially in the US healthcare system. A rheumatologist is looking for joint damage. A neurologist is looking for nerve lesions. Your dentist just sees cavities and moves on. Nobody's really trained to zoom out and connect all of it back to one single disease. And remember that basic blood test I mentioned at the start? That's the standard ANA panel, and it can come back completely normal even when Sjogrens is sitting right there. The test that actually catches it is looking for 2 specific antibodies, anti-SSA, also called Rho, and anti-SSB, also called LANE. And most of the time, those don't get run unless you specifically ask for them by name. So if a couple of these hit close to home, here's exactly what to say at your next appointment. Ask for the anti-SSA, Rho, and anti-SSB, LA, antibody panel by name, not just the basic ANA. If dry eyes are part of it, ask for a Schoma test, which measures your actual tear production. And if your primary doctor isn't finding answers, ask directly for a referral to a rheumatologist. To be clear, this isn't about diagnosing yourself off a YouTube video. It's about not letting everything looks normal be the end of the conversation when you know something's actually wrong. Alright, like I promised at the top, I put together a free printable checklist with everything we just covered, so you can literally hand it to your doctor instead of trying to explain all this from memory. It's linked right below in the description. If any part of this felt like it was describing you, drop a comment and tell me which signs hit home. I actually read all of them. And if this helped you connect some dots, hit subscribe, because next week I'm walking through exactly what to say to a rheumatologist so you stop getting brushed off.